on February 27th, the last day of the month.
Is this?
No,
No,
tomorrow.
It's the last day of the month. Yeah.
We all missed for Tuesday.
Okay.
That was a good recovery.
Is exasperated today. So we're just gonna have a little committee discussion. We have 5 days left before crossover. So we've been taking a lot of testimony on 340B. And we sort of went around the room last week on things that people might want to work on in the last remaining days. What we have capacity for is really important. There's a lot of very, very important priorities, and I recognize that there's priorities. But we're also in a time crunch. So I think that Daisy had taken a list of sort of what everybody had interest in, and we kind of collated with that a little bit to see what was general consensus and looked at sort of the time frame that we have left. We've identified a couple things that I wanted to see if there was general agreement. So we have H80, which is the Office of the Healthcare Advocate. And this is sort of making some changes around information that the healthcare advocate would be privileged to see. And several people had listed that. Talked to the Office of the Healthcare Advocate, and he felt as though that it would be a pretty easy lift, possibly. So I wanted to see if everyone was in agreement of possibly doing that. Yeah.
H80,
H80.
80, okay.
And since he happened to be the only one that came in this year and didn't ask for any money, maybe we should give him some language. The other one that was identified was the bill that Mari introduced around preventing workplace violence in hospitals. You know, we did a little work around this. I had thought we did a bill last year, but it turns out we just did a drive-by through over.
Which one?
It was,
That's 36 Act 24 about law enforcement.
it was law enforcement. That had been a judiciary bill.
Sears.
And Sears. And it was around, we were just talking about the healthcare advocate.
Imagine that.
There's a mic.
To permit a law enforcement officer to arrest a person.
You're the only one who got that.
So that was a judiciary bill. But we did take a lot of testimony on it, I remember, in this committee. Heard some pretty harrowing stories and to our guiding principles about supporting and valuing our healthcare workforce so that they can provide excellent care.
259 is the one.
Sorry, yes.
Yeah, it's 259. And this would make sort of changes, and we had, but I don't know, was it a week or two ago? We had the Nurses Association in here, and this is a pretty critical.
We had them in here this summer too.
Yeah, and they were here this summer, and this bill had been put together, and it has to do with creating sort of that hospitals need to have a safety plan Many hospitals do, but it's from the understanding that not all hospitals are the same, and some hospitals don't have the resources that other hospitals have. And a lot of people identify that, and I thought that that was something that we could focus on.
There's no money with that one either.
And there's no money with that. Does everyone,
Yeah, just,
Yeah.
what was the other bills? Haven't got a game plan.
H80,
H80, okay.
okay?
Okay, Office of Health.
Would the healthcare advocate like to give us just a brief synopsis of what he hopes it's, why the bill was introduced? And
No.
I mean, we're not taking testimony on it, but just briefly explain to us, Bill.
Good afternoon, Mike Fisher. 98% of the bill is to have the statutory language comply with what our actual practice is. There's a section of the bill that or there's maybe two sections, there's two details in the bill that seeks to correct things that we think are wrong in the statute or that we would like to update in the statute. But for the most part, it really seeks to it seeks to comply with what our actual practice is. And I'll give an example. I take our mandate very broadly to be an advocate on behalf of Vermonters to get access to care. The language in the statute is a little bit more about uninsured and insured and people on Medicaid. And so, like, for instance, when we find ourselves advocating for people in a correctional facility to make sure they get access to care, I kind of have to dig and weave through our statutes to see that I actually have a mandate to do it. So it's for a long time, I have thought it really makes sense to just be clear as a direction to me and as a direction to whoever comes after me that this office is about improving Vermonters' access to care. I think that I believe that our interaction with the legislature and the way we present ourselves is to have some independence. And I have never had a member of the administration seek to control what I'm about to say in front of a legislative committee or publicly. But I don't think the statute's strong enough in sort of clarifying about our independence, that we are a watchdog. And if we need to speak out in being critical of one part of state government or another, that it's our job to do so. And so sort of clarifying our independence. There's a bunch of sort of technical stuff, taking out the word consumer and adding in the word Vermonter. And then I'll just mention, I know I'm going to miss some because it's been a little bit since I've looked at it, but there's a few, we've bumped into some frustrations with the Green Mountain Care Board around our right to confidential information, particularly in the CON setting. We had one situation last year where the board said, go seek permission to see the information from the regulated entity, from the hospital. The hospital was happy to give us that information. We maneuvered through it. So it ultimately worked. But what if the regulated entity didn't want to give us the information? We have access to, we see confidential materials in hospital budgets, in rate review, in CONs, in ACO regulation. We have a tried and true practice about how to maneuver through that stuff. We write comments to the Green Mountain Care Board that have confidential sections of them that have to be redacted before they're posted publicly. So we know how to do that stuff. But there's one piece, the statute that we wanted to clean up. And then finally, the one place that might draw a little bit of heat is in hospital budgets, we get to ask questions of the hospitals. Nobody regulates what questions we can ask of the hospitals. In insurance rate review, we get to suggest questions of the board's actuary. Recent practice has been that the board has forwarded our questions unedited. It's only very recently, not too long ago, we had our questions edited or denied on occasion. And this has been huge frustration for us. When you're developing a case, we're talking about pre-hearing questions. When you're developing a case, the purpose of pre-hearing questions is to, hey, you think, sorry, I've left my stuff on that. Oh, you can just, you go down, they've gone down the rabbit holes to see whether there's something there. It might be that you think something looks funky, you ask a pre-hearing question and get a good answer. Don't need to follow up. And so there've been occasions then where we have not been able to ask questions, and we've and sort of almost the most extreme. It's a little bit extreme, but I kind of want to say, you want a public advocate at the table? You got to let us. You can't tie an arm behind our back. We got to be able to participate. And so I could give you an example of that, but I think I will. I think I'm so that's the one place that we might get some pushback from the insurance carriers.
Could you just say that pushback from whom?
The insurance carriers.
So that was going to be my question.
Yeah.
Thanks for,
What section is that part under in this?
I can't remember. It's the insurance rate review section. And if anybody has, it has literally been months since I've actually looked
I know.
at things. So I'm sure I missed pieces.
Haven't looked at it in a while either.
Yeah.
Let's go.
I think that it is in Effective Duties and Authority, 9603.
We're gonna walk through the
We're gonna walk through it
anyway.
Okay.
That's what
I'm just liking this so
Um,
much, and I'm actually understanding this so much. Finally.
So you're saying you are absolutely report it. It's like you just found your first.
I did.
I would say my very first bill report was on a healthcare advocates bill. Still near and dear to my heart.
Smashed it out of the park.
It's a good one too.
It was a good one. All right, thank you. That's two. So workplace violence, if everyone, and 8.
I have two. I'd like to.
Oh, okay.
Can you just real quickly introduce?
Oh, yes, let's introduce, which I met people in the area earlier, so they're here in our room.
My union siblings from AFT are now in the room. We can do roll call, but very glad to have them all here. They'll also be in the cafeteria at 6 p.m. I'm gonna announce y'all on the house floor, but then there's a reception at 4 p.m. in the cafeteria, right?
Welcome.
Yes, thank you.
Yeah, wait, you were before last time?
I have something to say about Talia.
Oh, yeah, Talia. Do you want to say something? Let's let Mari say something. Mari.
I love it that you
Daisy.
confused me with Daisy.
Let's let Daisy say something about the tally of votes and then Leslie.
So those were, Alyssa just noted too that were the highest tally, but there was another one that was in the top 3, and it was the youth mental health one. But I'm going to advocate that we not take that up right now. And I'm gonna advocate that we not take that up because I'm receiving that providers as well as staff at the state do not need one more new thing to do right now. And also there is a challenge with the funding mechanism in the bill. So I think when it gets to Ways and Means, it would be a real challenge for them to get it out. So I don't think now is the time for us to try to work that bill. And I fully support us focusing on the two that we just talked about.
What about this one?
I was gonna talk about that one, but I was gonna let Leslie talk for a little bit.
Okay.
Raisy, what was that number of yours? I remember I supported.
323.
323.
No, I identified the two topics, but then, yeah, Leslie.
So I apologize, I think I missed these discussions because I had to not be here, but there were two bills I just wanted to pick out for possible consideration. And one is the birth center bill, and I'm not sure where that landed.
Yep. You were here during our discussion. Can I interrupt it for a minute?
Sure.
Okay, we had a lot of interest in, and I will tell you, here are the bills. The birth center bill, the Senate, I don't know if they voted it out yet, but we will be getting that bill from the Senate.
Okay, great.
Okay, we will also be receiving, hopefully, so the doula bill that was in the Senate, which was in Senate Gov Ops, that's actually been voted out. So I don't know if it's gonna go to House Gov Ops, but we will obviously take an interest in that because schools. And there was a lot of interest around that. There was also, there was general interest in a lot of these larger bills that we have on our wall, kind of around hospitals, sustainability, sort of larger, broader picture health systems. And it is my understanding, I asked everyone to take a look at Senate Health and Welfare's website. I'm not sure if it even has the bill number yet, but they have been working on a committee bill that has very broad ideas, things like that in it. And we will be getting that.
Are you saying there's gonna be a healthcare omnibus bill that we could add things to?
No, not necessarily. More of I'm kind of looking at it as sort of a state plan. Healthcare state plan bill. But it's not even a bill yet. There's lots and lots of documentation on their website about what's in it. And there's a whole outline. And the outline sort of goes
I
through
see that.
things. So, and what else will the Senate be sending us?
There is no
And
number.
medical debt.
Teasing.
So
Wait, can you say the thing about medical debt?
the companion
Yeah.
bill for the one we, H-112, they will be sending us that.
Okay.
So, yeah, and the care board stuff is kind of in there. And although there's another bill in the Senate, which I think they're hoping to get out. So I'm taking those things off the table for our purposes because we will be working on them later. So I'm glad everyone had a great interest in a lot of them. Leslie, the
So
second
some
one.
bills, I've been contacted by a lot of people. This is, I think, more of an issue in the southern part of the state. But when we expanded Act 39, which is medical aid in dying, to allow out of state people to come to Vermont to avail themselves of that law, it is huge amount of stress on our providers in the southern part of the state, particularly Grace Cottage, who are very open to doing that work. So H-75 wants to expand providers who can use medical aid in dying and allow that to be part of their scope of practice, including PAs and nurse practitioners. We've got I've gotten a bunch of letters about that from docs in that area. It's not urgent by any means, has no money. So if for something that has no money, that was, just thought I'd throw it out. We could do it another time, but if, just to have some thoughts about supporting the dying law of Vermont.
It also adds the scope, so that, naturopathic physicians can do not resuscitate in cold orders.
And like, I've looked at that bill. And first of all, I think it's really important. And I'm not saying that we won't get to it. My only thought around it was as far as the timing we have, and I have not had any conversations with anyone about this, but I have a feeling it would need to go to human services.
Oh, yeah.
Human services is really who has, so it would, it would take, a great deal of our time, but then it would also require human services time. So I don't think it's something we could get out.
Could we get some type of a marker or the ones that we are not going to fool anything with? You said 2, 3 are in the Senate, and some we're not gonna touch at all.
I think that we can do maybe some little color coded marker. I think we've done that in the past where we've kind of ticked things that
Yeah.
might be somewhere else.
Let's look at, yeah, that'd be nice, thank you. At least for me.
There was one other, and I'm not sure if we can get this out. I mean, I'm gonna say 3 bills. So 2 already, workplace violence and 80.
And what?
H80, the healthcare advocate one.
Birthing center?
Birthing center is coming from the
Oh,
Senate.
that's what you said, sorry.
Sorry, apologize.
We're only considering ones that have no money.
Honestly, we've made our budget recommendations to
Okay.
appropriations.
Just wanted to make sure.
And at this point, I'm recommending that we don't do anything that has
Okay.
money. Now, because the mental health in schools, the youth mental health bill, we really haven't done anything in this committee around mental health, other than obviously our budget recommendations.
I mean,
And
this year.
for this year,
Okay.
that's what I mean this year. No, we've done lots in the
Yeah.
past. But it's such an important issue. And we've heard a lot of testimony around access to psychiatrists, prescribers. And we do have H237. If you remember, there was a bill last year. This is what this doctoral level psychologists prescribing. So it's kind of an OPR bill. And we had done work on this last year. And we had asked the Office of Professional Regulation to give us a sunrise report, which they gave to us in January of this year. And 237 takes the recommendations from that. So I'm throwing that out there also. It's something that.
Hey, I don't know what that is.
Okay. We can send Kristen, did we post that the other day on our website? I don't think so. Let's see if we can, we'll get that posted. It's a study. So,
I did, it was a study about this.
Before.
Not a little low known thing.
so if we have time, I'm suggesting that we think about that one,
About.
237. And because it was not on our wall also when we did this discussion the first time, if we have time, instead of 237, we also have the dietitian compact.
There's also a school psychologist compact.
Yeah.
We could just do all the compact, all the professional regulation stuff.
Three compacts?
Yeah, but you're talking money though, with the compacts, aren't you?
It would have to go to Ways and
Secretary of
Means.
State.
They would have to go to Ways and Means because they're fees. Which if we had it voted, if it was voted out of our committee by next Friday, that's fine because the money committee's crossover is a week later.
Are you saying that, though, Woody, that there's a cost to passing those?
Well,
bills?
there might be, I mean, the Secretary of State's office might have to
Yeah,
hire a person to manage that. Might, just might.
yeah, I hear that. And there may be long-term economic gain, but there may be
Yeah.
that short-term investment needed. Yeah. Can someone tell me is the workplace violence one? I want to read it quickly. Is that the 259?
259, yeah.
And also we have to talk about 340B again.
Ugh,
So
sorry. It's over.
I just want to make sure, is there interest in moving forward in some regard to some of the things that we've heard? Yeah,
There is for me. I think it's important to our hospitals and our communities and our system here. I know some of the testimony we've heard, like from a national perspective, makes it seem like it's this big thing that needs to be revamped at the national level. And yes, it probably does, but we have to look at it in Vermont perspective.
and I mean, personally, when Charlie was testifying today, reminded us that all the testimony that we've heard has been all legitimate and concerns on both sides, but you know, what's best for patients, what's best for hospital sustainability right now, what's best for our FQHCs that we just recommended as our number one top priority to appropriations.
I support that if, wrapping up 340B, whatever we're gonna do with it. H80. Addressing hospital violence. And if we have time to do more. Absolutely doing is it 237? 237, if we do any compact though, I would definitely want to do the school psychologist compact.
Thanks, I forgot.
I want to be sure that we do something for our youth if we have time to do that.
What is that number, Daisy?
That one is 325,
Yes,
page
yes.
325.
Thank you.
If history is any predictor, I would imagine that we could have a compact voted out in less than a day.
We could have a compact day and hear from all the compacts and pass them all out of here in one day, if we really wanted to.
Have we told our new members the compact language we can't change? Have you guys had that discussion?
Well, no, but we will. Thank you for.
They could start with that.
Yeah.
They could start with that. Yeah.
Yeah, if you open up, if you look at one of the compact bills, they are these monumental, you're like, oh my gosh, 80-some pages. You can't actually change anything in the bill because that is the compact. It's usually just the first section that says we're joining the compact.
So it's like, could be multiple states?
Yes.
Yeah, compacts are typically where a license from a compact state, somebody can apply for a compact license and they're able to practice in any of the states that belong in that compact.
I respect that.
Leslie?
So I think there are 4 compacts, right? It's like dietitians and school psychologists and.
There's there's 2 more I spelled.
Dental hygienist. I'm going to recommend that we not do the dental and dental hygienist at this point.
I'd just like to think about impact, that if we're gonna do a compact, how can we pick the one, if we got one, that's gonna have the most impact by numbers of getting people working here? That's what I don't know where that data is and how we might know.
There's also the fact, I'm sorry, I don't mean to interrupt you, but there's also the factor of the need of the people though.
both sides.
Yeah.
But, you know, if the school psychologist is 3 people and the dietitian is 50 people, making that up clearly, but how do we get a sense of where we want to put our resources and time? But to see time as a resource here.
Well, we get one vote. If
That's your vote.
If email is any indication, there seems to be a great deal of interest in the dietitian.
Yeah.
one.
Well, I mean, just back to what I was saying about a compact day, like, Vermont 25, the day starts off with Ledge Council giving like an hour review of what a compact is, what we can and can't do, how it all works, so everyone understands it before we move forward. And then the second hour, the dietitians make their case. The next hour, the school psychologist, we go, the Secretary of State comes in, weighs in on all of them. And then we vote at the end of the day. It could be that, or the next morning we vote. It could be that quick. And if we did that, it would really be a huge jump in workforce development we could really do that in one day. Maybe it's easy for me to say this because we've passed so many of my time here, but as long as everyone understood what we were doing, once Ledge Council walked through it, it's really not controversial. It's just allowing people to, it's allowing people to have licenses across state lines. And I think Woody's concern could be addressed that day too, if we could hear what the cost is and stuff. And thank you for making my case. I think we should do a compact day.
Can we just start with our priorities? We got the top 3 and these others can follow.
Okay, so so the top 3 we have are. I'm sorry, did we get can I get a general consensus of whether or not we should move forward with 340B in whatever form we take when we do walkthrough on it? And also, we have now heard from hospitals, we have heard from FQHCs, we have heard from Planned Parenthood. These are all 340B, I'm forgetting the word, entities, thank you. Thank you. I am fried today, people, I am sorry. We heard from, pharma, we heard from the insurers, and we heard from the healthcare advocates office. Is there anybody that people feel we have to hear? We did reach out to a contract pharmacy and we were unable to actually receive any testimony on that. Is there anybody that people feel that they need to hear from before we do a walkthrough and start making decisions of what we'd like to keep, not keep? Anybody? Okay, so I will schedule for tomorrow, walkthrough, markup, not walkthrough, I'm sorry, markup, 340B.
Is that both those bills?
If we decide we want to take something out of one and move it to the other.
May I ask?
Yes,
Yeah, so not knowledgeable in this area at all. So when does one do that? When is it appropriate? And when does it make sense, I guess, to move one bill with the whole thing rather than trying to have 2 separate bills?
well, the other bill has other pieces in it that doesn't have anything to do with that. So that would require that we would then have to take that bill and we would have to dive into that whole bill.
It's germane.
Just the name, I mean, to this bill, 266.
Actually,
I'm thinking about last year's 266, so that's a little part of my mental misery.
So because the sections on 340B are germane to 266
From 202.
from 202, we could take those 2 sections out of 202 and put them into 266 if we chose in committee discussion and markup.
But does that make it, well, so that's, I guess I should not ask any more questions until we get there.
That doesn't mean that 202 goes away.
Right, and so how do we get what we want? How do we get a stronger bill? What's the strongest bill? I guess that's my question.
We can talk about that tomorrow when we're like working on it and talk about our priorities now.
Okay, so I will schedule tomorrow that we will do that.
Thank you.
Okay, so we got that.
Not that I don't care, I was just,
We have that
we should
tomorrow.
spend time on it.
It's Katie with the,
Okay, so let's do after the floor tomorrow.
Oh, God.
It's available. We need to ensure that our ledge council is available, and they're being pulled in many, many, many directions right now, so we need to be patient with them too. 11:30,
I also did hear that. So that might be the first bill.
okay, well, let's start 11:30.
Okay.
266.
266, markup. Okay, yeah, Brian.
So is what I'm hearing, just to make sure I understand, that we've decided there's interest in working on the healthcare advocates housekeeping bill, or whatever you want to call it, the workplace violence in hospitals, although I hope we can talk about other workplace violence in the healthcare system bill. And then if there's time, obviously we're doing something with the pharmaceuticals, but then if there's time, we may look at compacts, or what was the other thing that was identified? Thank you.
Prescribing
Okay, thank you. All right,
psychologists.
but that's what I've heard so far.
Yeah.
Okay, just making sure.
Okay,
That sounds like a lot in a week, but I think we could do it.
how about we start next week? We're gonna start trying to do something on workplace violence tomorrow afternoon. We're gonna try to get 340B out of here. And when we come back from our break, we're gonna continue with workplace violence. We are going to start on H80 when we get back. And at that point, after the first day or two, we'll see how we get. And if we wanna, then we'll decide whether or not we wanna do some compacts, or whether we wanna, if we have time, if we can do compacts, or if we wanna do the prescribing psychologists. Okay,
If there's time, can we do the universal healthcare bill?
yeah, absolutely. We'll fit that in. Friday
No,
afternoon.
I'm
Did you say
kidding.
right?
I'm kidding because I looked at the Senate bill and it would be the perfect vehicle for the universal health. No, it's not even just to look at it. It's actually like a potential universal healthcare bill. So I'm happy with
That's
that.
why I laughed at the omnibus bill, because it sounds like a great.
Yeah.
When I saw that, I was like, what are they doing?
And I'm not sure if we will have much from the Senate the week after our crossover date. Remember, that's still when the money committees are working fast and furious. And so we might not have something, and I'm hoping that we can take some testimony on some things that maybe long range we want to work on. Okay? So we'll hopefully have that week to delve into some topics that we want to. I'm sorry. I'm ending committee now, and so everybody is gonna have a nice long break before floor.
Thank
This
you.
has been a really long week.
Yes, it has.
It's been, and I feel like we haven't gotten anything done this year, but it's felt, so no offense, but it feels like the longest year ever and nothing's getting done in the legislature. I don't understand it.
We
Huh?
got 3 bills out.
No, but I just mean in general.
Yeah.
Like, it feels like we'll talk about it later.
Yeah.
We need a break.
Thanks, everyone. I was about to say have a great weekend. It's on Thursday.